Well, good Sunday morning to everybody. It's Mindy. How is everybody? All right. I'm looking at all the good morning comments. I have a couple questions. Let me get a pencil so I can make sure I write those down. Pencil. Let me see. Good morning. Homework. I will go over that. Hello. I'm doing great this morning. I have been up since way earlier than I normally am because I went and got something fun for us to do later this afternoon. Aren't you guys excited? So we'll have a little dissection again this afternoon. Fun times. So how'd everybody do on their midterm? Good. A lot better than you expected. Good. Super stoked. Awesome. That's amazing. Great job. Well, good. Awesome. All right. I know I asked you that on Wednesday night too, but just in case you weren't there, great. I'm glad you did good. Let's see. So we are in the home stretch here. Let me see. Can I minimize this? I can. Let me see. Let's open this. That's not what I wanted to open. This is what I wanted to open. Okay, so we are, what day are we on? We are on the 21st. Thank you. Yeah, it's been a long morning already. Okay, so we're on the 21st. So you guys finished your midterm. And we did bone formation. So today we're going to do circulatory system. So I'm splitting the day with Denise. So you'll have me in the morning and then Denise after lunch. And then me and Denise for a little bit. So circulatory system. And then you have lymph left, digestion, benefits and endangerment, final exam, and then the last day is the endocrine. Okay, so here's the deal, guys, is there's not a lot left, right? And somebody asked me about the homework. It says that the homework assignment for the last class is due on Saturday the 13th by 5 p.m. So it should say Tuesday the 13th by 5 p.m. So we give you that extra time to study for the final exam and not worry about the endocrine homework so that you can get that extra little bit of studying in for the final exam. But you can always do the endocrine homework early if you want to. But this endocrine homework is due Tuesday, the 13th, September 13th by 5 p.m. Does everybody understand that? Yes. Okay. No, you don't understand. So on your syllabus here, it says that the homework is due Saturday, September 13th. Well, that is wrong. It should say Tuesday, September 13th, because if Wednesday is the 14th, it should be Saturday, wouldn't be the 13th. Okay, good. So just make yourself a note, or you can just keep it the way it is and have it, you know, turn it in by the 10th, and then you'll be done and you won't have anything to do that last week. Okay. Sound good? All right. It also says sense groups on the last day. So I'm gonna explain the sense groups. Okay, good. Yeah, this is funny. Somebody forgot to transpose those. Anyways, so let's just do this. We'll make this Tuesday. Okay. All right. So it says sense groups right here. So I'll give you a second and you guys can click a little picture of this, and that way you have it somewhere ready for yourself. So when the time comes, you can revert back to it. Okay, everybody has it. All right. Okay, so sense groups, let's see. Do this, extra credit. So the sense groups are extra credit. Come on, Word. The sense groups are extra credit. So for extra credit, if you need more credit, you can do an extra credit project. And what it is you're going to do a presentation that's going to be 10 minutes on one of the sense groups. So you get to choose between sight, smell, taste, or hearing. Let's see if I can put my little camera up here so you guys can see me this morning. There I am. Hi. Okay. So you can choose sight, smell, taste, or hearing, because we're already talking about touch because we're massage therapists. So, you know, of the 5 senses, touch isn't going to be one that you're going to be able to choose because we already talk about that one a lot, right? Because we're in a touch profession. So the other 4 are up for game, okay? So that's sight, smell, taste, and hearing. Your presentation has to be 10 minutes because if we get a lot of people doing them, we need to have time for everybody to present. It needs to have pathology, anatomy, physiology. It can have some healing remedies or therapies, or, you know, whatever else you want to put in it. It can also, and it can be any way you want to present. So we've had people do puppet shows. We've had people do songs. They wrote a song about sight, or we've had people do singing bowls for hearing, and all kinds of stuff. When we used to do these in class, it was a little more, you could do more tactile things, like for taste. You bring in a bunch of different things and have people taste things, but we can't quite do that. But I mean, you could do something more along the lines of, like, maybe you make like a video of a group of people, and they're all tasting different things, or whatever you want to do, and do like a blind taste test. Who knows what you want to do? Some people do interpretive dancing. Like I said, make a video. These are all just like a little bit of like things that people have done in the past, but you can do whatever you want if you want to do this. And this will boost your score by 25 points. If you need the extra points, this is great. If you know other people in the class and you're around them, you can do this as a group presentation, and then everybody in the group will get 25 points. However, if you do it in a group, then everybody has to participate in the group. If you decide at the last minute that you don't have time, and your group tells me, hey, you ducked out, you're going to lose 25 points, because that's not fair to your group. Does that make sense? Yes. Okay. So if you make a little video or something, we need to have Dan format it so that it can be played in the webinar. If not, we would, make it so that you can talk during the webinar and do your presentation. Like if you wrote a paper and you want to read it, or if you just want to sing a song, or however you want to do that, we can do that for you. But you're going to need to email Denise and let her know. Denise, yeah, email Denise and me, email all three of us. Just put us all on there and let us know what sense you choose. Okay. So that's the first thing you're going to do. You're going to let us know that you want to do a scent group and what sense you want to do. Okay. And this is all extra credit, so it's all on you. Does this all make sense? And people have a lot of fun with this, and we love watching these and having these done in class. So, this gives you a few weeks to, get it done and have time to prepare it and do whatever you're going to do. So, does this sound interesting to anybody? The due date. When's the due date? So you will be present, the presentation will be on the last day of class. So you need to have this done the Sunday prior to that Wednesday, so that Dan can have the couple days to format it. So what is that, the 11th? Or if you're just going to have us unmic you, you could have it, ready that day. Okay. And if you don't know where your points are between your attendance, not your attendance, just your points from your homework and your midterm. I can look them up later this afternoon and let you know what they are. So if you put in the question panel right now, please look at my points. I'll write down your name and I can get back to you. All right, I'm writing down names. So my thing for you guys is don't log out at lunch so that I can just put it in the question box at lunchtime to give you your answers. Okay. 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 No problem. No problem. Yeah, so I will, everybody who just wrote down, check on me, I'll do that. If you put in that you want to do one of the census, please also email Denise, myself, and Dan that you will do one of the census. That way we have a record in an email. Thank you. Okay. Why is this being a booger? All right. Okay, so sounds good, everybody? We're all on the same page. So you need 240 points to pass the class, or 280s on your midterm and final, and then your attendance. So the way we do it, right, is so that we give you the homework so that you can do not so great on one of your tests. That gives you that extra boost so that you can have the correct amount of points. So we're all aiming for 240 points. Okay. All right, let me get out of this. Let's go back to here. What is this? That is not what I want. That's not what I want. I don't like it when it does stuff like this. Anyways. All right. So we are working with the circulatory system today. Looks like everybody's here now. All right, perfect. I'm taking myself off camera. Okay, so we have this beautiful picture of a heart right in front of us. Nice heart right there. Let me see. Hold on. Is that better? Yeah, okay, perfect. All right. So we have this nice picture of this heart. And for some reason, on Denise's PowerPoint, the heart beats, but not on mine. So we don't get that coolness, I know. It's all right. But that is a heart, and you can see some of the valves here. And this chamber is a little bit bigger than this chamber, right? So it's kind of like a dissection of the heart. It's kind of a cool picture though, I think. All right, perfect. All right. So we're going to talk about the circulatory system, which is a closed system. We talk about both the circulatory and the respiratory system when we're talking about the circulatory system. So we also talk about respiratory because we add the lungs in here for how they oxygenate the blood for us. So you'll hear both things in this lesson. So when you're reading your lesson, you probably got both parts, right? Circulatory and a little bit of respiratory. Okay, so yes. Yeah, so circulatory system has another name that you've probably heard is cardiovascular system. You've probably heard it as the cardiovascular system. Let me change my, no, choose my pen color. Oh, that's much bigger than I thought it would be. So it's also called the cardiovascular system. Cardio means heart. So when you see cardio means heart. And vascular is going to be vessels. Right. So heart vessels, a heart vessel system. So it is a closed system. Could you use a different color? Blends a lot with the background. Oh, yeah, on the next things. So cardiovascular system is closed. So when we break the system, what happens? When we break the cardiovascular system, what happens? Take a wild guess. Yeah, we bleed. That's right. We bleed. Very good. Very good. So this is just, these pictures are from your book. It's a really, great pictures. We have them again in our slides, just showing you, how the heart comes and it, comes out, and then it comes down, and it feeds into your arms, and it feeds down into your legs, and it feeds up into your head. So, and then it shows you the superficial veins and the deep veins. So the first one is arteries, and the second one is the veins. Arteries are always depicted as red, and veins are blue. So that shows you in anatomy pictures to help you out. So our first definition is for artery. Artery is for leaving the heart. It's a big hose for leaving the heart. So artery for away. Artery for away from the heart, leaving the heart. It's deeper and thicker than veins, has a thicker layer of smooth muscle, and it usually has oxygen-rich blood in it. Okay, but it's a hose. It's a hose, right? It's a hose. So it's a one-way hose. One way in, one way out. So this here is a vein, just to show you the difference. This one is a vein. So you can see how thick this is versus how thick this one is, right? You can see the thickness of the artery versus the vein. And you can see also in the structure of it, the vein looks a little bit different than the artery, okay? In our artery picture here, we have a bunch of layers, right? So this one right here, this layer right here, should look a little familiar, right? So that's epithelial tissue, which should sound familiar because we talked about that on Skin Day. So it's called the endothelial tissue. It's easier for me to write with the other pen thing. Endothelium tissue, which is epithelial tissue. Okay, so this is never ending. This runs through all our arteries and all our veins. So you can see it in the vein wall here and in the arteries. Okay, it's continuous and it goes all the way through, even in our heart. Okay, this right here, this white part here is elastic. Is elastic. So it gives it stretch, right? Because elastic gives us stretch. Okay, so elastic gives us stretch. So our arteries need to stretch because they need to like be part of it, because our heart's a big pump, so it pumps into these. Artery has veins. No, an artery leads into a vein. They're different. That's why I'm showing you the difference. This is a vein right here, and I'm showing you the difference with the thickness. See how thick the wall is here? It has 3 layers. So it has 3 layers. 3 layers. And they're called tunicas, the layers. Tunicas. And you don't really need to know that they're called tunicas, but you might see that on like an MBLEX test, or maybe when we do the ABMP, you might see like a question that says something about the tunicas. Okay. And then we have this right here is smooth muscle. What does smooth muscle do? Contracts, right? Good job. So we have smooth muscle and elastic for stretch. So we have a muscle that contracts and elastic that stretch. So when the blood comes in, it can stretch out and hold a lot, and then the muscle contracts, which pumps it through, right? Because it's a hose. It's got to go somewhere. And that's how it holds our pressure, right? So it's very elastic for the expansion and the pressure, the tunicus. All right. So we have epithelial tissue, we have smooth muscle, and we have elastic for stretch. Okay. So arteries are for taking blood away from the heart. And they're always large. Arteries are always large by the heart and smaller away from the heart. So remember when we did the bone and we saw that in the femur, we saw that artery and it looked really small? That's because it was further away from the heart. So if we were looking at one closer to the heart, it would have been a lot bigger. Okay, did everybody have time to get this? I'm gonna go to the next slide. No answers means yes. Can you guys hear me? Yes, okay. I don't know if my thing just went, whatever. Okay. So then we go to a vein. So next is a vein. So you see in the picture right here in the picture, this is the artery. Remember? The artery that we just looked at. So you can still see the difference. But now we're looking at a vein. So a vein is also a hose, but it goes to the heart. Okay, so veins take blood to the heart. Arteries take it away from the heart. Okay, so something that you might hear is venous return. Venous return means going back to the heart. Veins are more so superficial. They usually are oxygen poor. That's why we depict them in blue, right? Because they're, don't have a lot of oxygen. Their walls are thinner, but they still have a smooth muscle. But what they don't have, and you can see here, is that elastin, right? They don't have that white part right there that looks like Swiss cheese. They don't have that elastin. But they have this cool thing in the inside here, which is called a backflow valve. Okay, so these thin folds make it so the blood doesn't come back down, right? So in your arms, in your legs, our blood has to defy gravity, right? So it has to come back up your arm to go towards the heart so that it doesn't defy gravity. These little backflow valves close so that it gets pumped back up and doesn't ever come back down. And sometimes when you get, if you ever go get blood work and your phlebotomist is a really great phlebotomist, they sometimes put the needle right through here and they can feel when this backflow valve opens and closes. So they might get right here and it's closed, and they can feel when it opens and they can push through so that they can get your blood better. Kind of creepy, huh? Anyway, so it's one way. So it's one way. So I have these little valves to prevent the blood from backing up. So if our blood stops, what happens? If our blood stops moving, what happens to it? Do you guys know? Yeah, it clots or it coagulates, right? It clots is a better, it's coagulation or clots. So that's how we make, our own, not so much as that, but when the blood stops, it starts to clog, it starts to clot. And, on the outside of our skin, when our blood stops and it starts to clot, we already talked about this, it makes our own, Band-Aid, right? We get a scab. So on the inside, we really don't want this to happen. We want it to keep moving. Okay, so the walls are thin. So we have thin walls, and there's not a lot of elasticity or smooth muscle. There is some smooth muscle right here. This is the muscle. And you can see here the endomysium, endothelium, hard word to say, endothelium. As it's still running through our system here. Okay. So, thing to remember, this vein goes back to the heart. Oxygen poor. Okay. Those are things to remember. Goes to the heart, oxygen poor. And they're more superficial. All right. Everybody get time to write this down? Perfect. Our next one is a capillary. Our capillaries are the smallest of the blood vessels, right? So capillary, just remember small, right? Small, tiny, microscopic, small. So small, I said so small, red blood cells can only travel through capillaries one at a time, which gives us microcirculation. Okay, so a blood cell can only go through one at a time. Okay. So these connect arterioles to venules, and we'll talk about those in a minute. Capillaries have thin walls, which are called fenestras. So you can see here, they have these little holes in them. We call them fenestras. Fenestras are like little windows. Okay, so it's permeable. It's the only blood vessel that's permeable, which means, you know, you can have things go in and out of it, right? Because we do all of our exchange in our capillaries. This is where we exchange our oxygen, our CO2, our nutrients, and our waste. So all of that happens in our capillaries. Okay. And then we have different kinds of capillaries. That's just a fun fact for you guys. So we have the fenestrative, right, which are like these. And then we have continuous capillaries, and then we have other ones that have different names. So just know capillaries we have all different kinds. Okay. So what do I want to know? When you break a capillary, that's where you get bruises. So when you get a bruise, it's because you broke a capillary, right? Bruises are broken capillaries. Sometimes you see broken capillaries in the eye. If somebody has that like red part in their eye, like next to their eye, like they scratched their eye, they broke a capillary in their eye. You know, everybody's seen a bruise before. So this is where all the exchange happens. This is where we bring in the nutrients and take out the waste, or in the capillary beds. We have tons of capillary beds. You're going to find more capillary, you find the capillary beds near every cell in the body. So capillary beds are by every cell in the body. So we have tons and tons of these, okay? So you need to remember that they're the exchange vessel. They're where exchange happens. Okay. So this picture is an arteriole showing you it's going, oh, yeah, here you go. Sorry, I went back. Tell me when you're good. Do you have what you need? Okay, perfect. Okay, so this is an arteriole, and it's showing you that the arteriole is going through the capillary bed to a venule. Okay, so you see the red for artery, arteriole, and then it kind of depicts in purple because red and blue make purple on the color wheel, right? And venule goes to a vein. So in the bottom here, it has a sequence. And the sequence is very important. You need to write the sequence down because you need to know that an artery goes to an arteriole, then the arteriole goes to the capillaries go to the venules go out to a vein. I'm giving you guys a little second to write this down. So arterial are small arteries that connect bigger arteries to the capillaries. Okay, so they're oxygen rich. Venules are little veins that connect capillaries to the vein. All right, so I wrote right here, so our arteries, remember our arteries have that elastin and the smooth muscle, right? So they can open up really big and have a lot of blood mass in them. So what happens is we need to be able to slow that blood mass down, because it can't just all rush into the capillaries like really fast, because our capillaries are super small, right? They're tiny. So we need to make our tubes smaller, right? So it needs to go into a smaller tube and then into a smaller tube, right? And then it's going to go into a bigger tube and then a bigger tube. Does that make sense? To get it back to the heart. So when we go from our heart to our artery, so our heart pumps it out and it goes into our artery, and then our artery pushes it to the arterial. So our arterial is going to slow down our blood pressure, right? So that it's not overwhelming our capillaries. So it can stay in the capillary longer, so that we can have a longer time to have the exchange, so that we can get more nutrient exchange and get more waste. Okay, and then it goes to the venule. So we've gotten the nutrients in and the waste out, then it goes to the venule, then it goes back to the vein, and then goes back to the heart. So if you look at trees, right? Trees do this. So this is how humans do this. And trees, if you look at trees, like trees kind of do it backwards to us. So like the leaves are their veins, and then they have the tiny branches, and then it comes down in, and then they do the exchange. They take the O2, right? They take O2 and make it into oxygen. That's the exchange. And then those branches, the tiny branches get a little bit bigger until you get to the trunk, and then you get to earth, right, which is the heart. So if you look at a tree, it's kind of backwards to us. I hope that made sense. Did it make sense? Yeah, it does. Okay. Good. Perfect. So I hope this is making sense to you guys, that our arteries, so our heart pumps into our arteries. So we have this big rush of blood and we need to slow it down. So we slow it down in our arterial till we get it to the capillaries, into the capillary beds, right? And then we push it into a venule that pushes it into a vein. And I'm going to tell you, this is a test question right here. This artery, arterial, capillary, venule, vein. So this is very important. You need to write this down. Make sure you have that written down. Okay, I'll say it again. So our heart pumps our blood into an artery. Our artery is a big hose. A hose pushes that into an arterial, which slows that down so that it can go into the capillary and go into the capillary bed where we can have exchange. From the capillaries, it goes to a venule, which is small, and then from a venule, it goes to a vein. and then it goes back to the heart because it needs to go back to the heart so that it can go get pumped back out to the lungs and get oxygenated and do this whole cycle again. Okay, good. So everybody good with this picture, this slide? So this next one is a picture out of your book, which is a really cool picture. So it's just re-going over everything that we've already talked about, right? So this is an artery, so you can see how thick it is here, right? And it shows you the layers, the outer layer, the smooth muscle, the middle layer, and the endothelium, right? And it shows you that in both, because this is the artery and this is the vein. So you can see how thick this is versus how thin the vein is. And this shows you the valves in the vein. And it has a really nice cutout right here. Both of them do. So you can see the elastic, the smooth muscle, no elastic, but smooth muscle, right? And it's coming down and it's going to come here into the arterial, and then it's going to go into the capillary and do the capillary exchange, and then it's going to go into the venule, and then it's going to go back to the heart from the vein. Okay, so this is just a really nice picture depicting like how everything looks like a better picture. But this picture's from your book, so you have it in your book if you want to like take a better look at it later. Okay. All right. So it is 10:57 and I think we need a little bit of a break. So I think we're gonna break until 10:15. Let's do 15 minutes this morning. Yeah, let's do 11:15. Break. Whoops. I can't even write. All right. Hope everybody had a nice break. Okay. Stevie, I left you a message. I hope you see it. Okay. Where are we? Okay. Pulmonary artery. So everybody's back because we're starting pulmonary. Pulmo means lung. Pulmo means lung. So you can guess where we're going with this, right? An artery is away from the heart. Okay, so pulmonary, pulmo means lung, so pulmonary artery. So this means it's going to the lung, right? So it takes blood away from the heart and goes to the lung so that it can become because it was oxygenated, it was oxygen poor blood, right? So pulmonary artery. So it comes from the veins to the heart, and then it goes to the lung to become oxygenated. So you can see from the heart to the lung, gets oxygenated, and then it's now oxygenated blood goes back, and you can see how it goes through. So it goes to the right or the left. So we have a right pulmonary artery and a left pulmonary artery. But either way, so they both come from the right ventricle and they go up, right ventricle, go up, and if it's going to the left, it goes this way. If it goes right, it's going this way to the lung. So if we have a pulmonary artery, what are we going to have? What else are we going to have? Good, a pulmonary vein. Good. All right. You guys have enough time on this slide? Perfect. Pulmonary vein. Pulmo means lung, vein is to the heart. Remember, to the heart. So it takes blood from the lungs and goes to the heart. So this is the veins. So we're looking at the veins here on this one. So on the last one, we were looking at the artery, and now we're coming into, so we're in the capillary beds doing our exchange, and then we go into the artery, the veins, and we go into the left ventricle back to the heart. Okay, so we did our exchange for our O2 and CO2, right, in our capillary beds. And we are now coming through the veins because we're now oxygen rich, coming back to the heart. Okay, so it goes from the heart in an artery to the lung, from the lung in a vein back to the heart. Okay, we're going to start talking about those chambers next. So everybody good with this slide? So atria. So atria is our first one. So the heart has 4 chambers. All right, so the heart has 4 chambers. The 2 superior chambers are the atria. Okay, so they're the 2 top parts. So in our picture, it says atrium. Oh, that's what we're looking at, the atrium, right and left atrium. Same thing right here. So the top parts, atria, plural, atrium, singular. Okay, so it has 2 superior chambers that receive blood from the veins. The left atrium is blood received from the pulmonary vein, and the right atrium is blood received from the vena cava. Okay, so this is a nice depiction of our heart, and the atriums receive, okay, big things to know, they receive blood. They receive blood and they're superior, they're the 2 superior. So the left one is from the lungs. This one's from the lungs. And the right one's from the body. Okay, so atria. So atria are superior. In Latin, they mean entry hall or chamber. Entry hall. So or chamber. So in Victorian houses, some of them have atriums. When you walk in, it's a big glass room. Usually they would have lots of plants or birds in the atrium. I don't know if that helps anybody. remember, like atria, entry hall, or chamber. Anyways, but they're superior. So you need to remember they're superior and they receive blood. I'll give you a second to finish writing that down. Let me know when you guys are good with this slide. Oh, good. Okay. The vena cava, it's an artery. Ventricles. Ventricles. So ventricles. Ventricles are away. Okay, so this is our aorta. It's our aorta, and you see our atriums, right? Our right and left atriums, right? So now we're looking at the ventricles. So the ventricles are inferior. So remember, inferior chambers. These are the other two chambers. So they're inferior. So they're inferior of the heart that pump blood away from the heart through the arteries. Okay, so away. Ventricles. The right ventricle goes to the pulmonary artery and the left goes to the aorta. So you see the aorta up top there, and you can see the branches. On the next picture in the aorta, it's easier to see, but it comes down, and it's going to come down through here like this, and then we're going to have two more arteries for the iliac. And Denise has a great story about the iliac arteries with her husband. But this line right here that comes down, because remember the heart is a little bit it's a little bit left to center in your chest. So when you do compressions in the chest and you feel that pulse in the chest, right? This is what you're feeling. You're going to feel this right here. You're going to feel these. these arteries. Okay. So this is lung and aorta is heart. So this is a flipped around view of this. Come in. You can't lay in there. Okay, sorry about that. All right, so the two inferior chambers of the heart are the ventricles. The two superior chambers of the heart are atria. Did you guys all have enough time with this slide? Perfect. Change my pen. So aorta. The aorta is next. Aorta. Okay, and your aorta is your largest artery. Your largest artery. You've all heard this before, right? The aorta. Okay. It comes out of the left atria. Comes out of the left atria. It's the largest artery, goes away from the heart to the rest of the body. Blood leaves through the left ventricle, and then two branches, superior and inferior. So in this picture, this thing right here, this little pillow looking thing, this is the left atria. All right, that's why it's red. And this one right here is the right atria. And it's blue. Okay. So this is your aorta right here. Okay, so see, it has these branches. This branch and this branch go off to your arms. I can't spell. And this one goes to your head. And this one's going to go to your legs. Okay. So it's going to come up through the heart and pump. All right. So the branches go up to the brain from the superior or ascending aorta are two ways you might hear that. The superior or ascending aorta. Or you might also hear the inferior aorta, which is going to be the one that's going to go to the legs. Or descending. descending inferior would be the same. So you need to know, goes away from the heart to the rest of the body. Largest, away from the heart to the rest of the body. Okay. It's the beginning of the systemic circuit. It's the beginning of our systemic circuit. Is our aorta. All right. Everybody have enough time with this one? Perfect. Vena cava. Vena cava. It's the largest of our veins. Largest vein. Vein. Large. So it's the largest vein. And the vena cava returns blood to the heart. Turns blood to the heart. So again, this is the right atrium. Okay. This is the vena cava, what we're talking about. All right. So this piece here. All right. Returns the heart, returns to the heart through the right atrium. It returns oxygen, poor blood. Okay. So it brings oxygen, poor blood through the heart so that it can go over and be pumped through to go back to the lungs to become oxygen rich. So the vena cava is the largest vein. It has an ascending or superior part to it. And it also has a descending or inferior part to it. All right, there's not a lot for that slide, so you guys probably got all of that. Good? I just need one yes. Either that or I'm frozen. Oh, now you guys are coming through. Funny. All right. Pericardium. All right, pericardium. Our pericardium. So peri means around. So peri is around. Cardium, again, heart. Right, cardium, heart. Peri is around. So it's a protective sac around the heart. It contains 3 layers of dense, irregular connective tissue and fluid. So there's a reason that it has fluid in it. And I'll get to that. So this picture right here is probably the best depiction of what our heart looks like in the chest. All right, so this is left of the chest. That's an S. All right. So that's just showing you the best, like, how our heart would sit in our chest. It doesn't sit down with the point down like that. It sits kind of like more like this picture. All right. But this middle picture here is really cool because it's showing you that in the middle here, this is where the fluid would be. All right. And this is the dense connective tissue, or the DICT, right? Dense irregular connective tissue is this right here. And then this is, what is this, you guys? Perfect. I had one person put it is muscle, but what kind of muscle? We have different kinds of muscle. Does anybody remember? It's left of the chest. Not smooth muscle, it's cardiac muscle. Good. It's a little bit left of the chest. Our heart is a little bit left of the chest, in the chest, okay? So, and then this whitish part here, okay, is the endo, so this is the epithelial tissue, but it has a different name because it's now in the heart. But it's that continuous tissue. So it's the endocardium. So it's the continuous of the epithelial tissues that was from the veins and the arteries. Remember we talked about that? From the blood vessels. Okay. So it's really important that we have a little bit of fluid here because the sac is protective, right? So it's a protective layer for us, for our heart. Our heart beats, you know, our heart beats. So when it beats, it makes friction, right? And with friction comes heat, right? So we need to keep the friction, the heat to a minimum. So our fluid here helps reduce the heat. It's kind of a cool design of our body, right? So it's it's helping to keep the friction, the heat from the friction of our pump to a minimum so we don't overheat our heart. Okay, so there's lots of, you might have heard of, like, you can get inflammation of the pericardium. It's called pericarditis. Anything with an ITS is an inflammation. Some people with lupus, they get extra fluid buildup around in their pericardium, and extra fluid. That's not really good either, because then the heart can't beat as well as it's supposed to. And then there's something, and I can't remember, I'm not saying it right. Pericardital, I'm not saying it right, so don't come after me, but it's with a friction rub. And so when the doctors listen to you with their stethoscope, they can hear this. And if it's not right, it kind of sounds like a cricket making noise. So that's one of the things they listen to, why they have the stethoscope on your heart, is for that friction rub to make sure that your fluid is at a good level, so you're not having too much friction or too less friction, or however you want to put that. Kind of cool, huh? So our pericardium is a connective tissue, right? So with all connective tissues, they connect to other tissues. So our heart is right here, and then we have a nice muscle that comes right here that connects to this pericardium. And it helps does anybody know what this muscle is before I tell you what it does, what it helps us with? We'll give you a couple hints. It divides our thoracic cavity from our abdominal cavity. I got one answer. I got two answers, three answers. Yeah. Good. It also helps with our breathing. I think this is on our list of muscles for Wednesday night. So this is our diaphragm. So our diaphragm connects right here. And so when we do deep, slow breaths, it pulls the pericardium, which helps regulate our heart rate. So when you go to the doctor and they take your blood pressure, and your blood pressure is really high because whatever, you race there and you were in a lot of traffic and you're a little bit stressed out, right? So you can do some deep breathing. You can sit there for a minute and you can just have a couple breaths, and then they come back and they take your pressure again, and it's lower because you did that deep breathing and you slowed this down because your diaphragm helped you do that. I think that's pretty cool that we can consciously do deep breathing to help slow our heart rate. It's pretty cool, huh? Okay, so pericardium is the protective sac around the heart. Everybody good? Alveoli. Alveoli. Our good old alveoli. These are our little air sacs in our lungs. Alveoli, little cavities. So our lungs are not hollow. They're not just big balloons. They have bronchial tubes and these little alveoli. So when somebody gets pneumonia, our little alveoli are filled with fluid. And this picture right here is just of one little alveoli. So you could see the capillaries on each. You can see it has lots of little capillaries on it to help it do exchange, right? Because what are we exchanging in the alveoli of the lung? Good. Gases. Exchanging gases, right? Because we need to change O2. We need to change CO2 to O2, right? We need to exchange. So that's what we're doing here. So this picture right here that has the red, the purple, and the blue, that is showing you the capillaries, and the one without it is showing it, without them. So alveoli, plural, they're the air sacs of the lung, 150 million alveoli in the lung. That's a lot. Lined with elastic connective tissue for breathing, right? So expand and contrast. When you breathe, the alveoli take in oxygen and you breathe out CO2. And just a fun fact, your right lung is bigger than your left lung. Okay, so in our alveoli, we have a protein that protects the elastic connective tissue. And when we smoke or have somehow we inhale smoke, could you know why the difference? My guess somebody asked, do I know why we have a difference in sizes of the lungs? My guess is because in our cavity, what's on our left side of our chest? Right? Oh yeah, we have a little bit more in there. Yeah. So when we smoke, whatever it is, even if we were in like a house fire and so let's say we work for the fire department and we're a fire person, and we trudge into buildings, and that's our job, and we inhale smoke, not because we smoke cigarettes or we smoke whatever we smoke or vape or whatever. When we inhale that smoke into our lungs, it breaks down that protein that is that, and it makes that elastic connective tissue not work as well. So this is why people tell you, you know, smoking is so bad for you, because it doesn't really help with the elastic connective tissue that helps you expand and contrast for the exchanges of gas in your little alveoli. Okay, let's see. Next slide. Oh, red blood cells. Their proper name is erythrocytes. So if you've heard of an erythrocyte, that is the proper name for a red blood cell. Red blood cells function is to carry oxygen to cells and carry away CO2. They have a concave shape for the maximum oxygen capacity. Interesting, huh? So red blood cells are erythrocytes. And we have lots and lots and lots of red blood cells in our body. So, excuse me. I don't know, that's probably about a millimeter, right? We'll just say that's a millimeter. In this tiny little millimeter, males, so guys, have 5.4 million red blood cells. And females who still menstruate have 4.8 million red blood cells per that little millimeter, per that little tiny dot. Okay, that just shows you how much we have. That's a lot. And you got to remember, okay, so we have that much in that little tiny dot. And the capillaries, they have to go one by one by one. I have no idea the number for menopause, postmenopausal women. I'd have to look that up. But I'm sure it's less. It's less than this. But just think about that. In our capillaries, which are teeny tiny microscopic, in this tiny little dot, 4.8 million for a female, they have to go one by one through that capillary. Are you guys envisioning this yet? It's tiny, it's a lot. It's a long line. It's a long line. Okay, so we need to know that our red blood cells carry oxygen to cells and carry CO2 away from cells. hemoglobin. Hemo means pigment, Globin is a protein, iron-rich molecule. Okay, hemoglobin. So an iron-rich pigment. The protein on the outside of the red blood cell, it carries oxygen. Each red blood cell has 280 million hemoglobin that carry oxygen molecules. So this right here is a red blood cell. And all the little yellow dots are the hemoglobin. Okay, so oxygen from pulmonary alveoli. Come down onto, remember I said we just all those tiny little blood cells, red blood cells, and they're taking them and they're transporting. Okay, so the hemoglobin is attached to red blood cells. That's what gives us that iron-rich color, blood stain. You know, when you bleed and it gets that brownish red color and it stains when it dries, that's the iron-rich color, comes from the hemoglobin, that protein. Okay, so that protein carries oxygen. On red blood cells. Okay. Quick question. Do you guys know what time Denise normally takes lunch? She takes it at 1 or 12, 12:30. Between 12 or 1. So you guys normally come back from lunch at 1? Not always the same time. No worries. Just asking. Okay. So this is our slide, how the blood cells travel. Oh, go back quickly. Okay. No problem. Hemoglobin. You just need to know that the hemoglobin are attached to red blood cells. Okay, perfect. Okay, so how a blood cell travels. Okay, so it says describe the route of a blood cell traveling from your little toe through the circulatory system back to the other toe. Okay, so we start at the toe. We're going to go up, right? Up the veins. Up the veins. Veins go into the what? We start at the toe. Where do we go? Veins go to where? Good. Veins go to venules. Venules go to what? Venules turn into what? Capillaries. Capillaries go to, what do capillaries go to? Capillaries go to arterioles. Very good. Arterioles go to what? Arteries. Very good. And arteries go to what? The heart. Very good. And then from the heart, yeah, well, we started at the toe, so we went backwards. So it's okay. We started at the toe, so we went backwards. But now we're starting, so we're at the heart. So we're at the heart. So we're from the heart goes to the artery. The artery goes to arterioles. Arterioles go to capillaries. Capillaries go to venules. Venules go back to veins, to the other toe, right? So it wanted me to take you from toe to toe. How do we get up and around the body to the other side? That's why it was a little confusing, because I started at the toes, the furthest away from the heart, right? So the extremities, the furthest away from the heart. You're still confused. Yeah, I can say it one more time. Okay, so we're the first, so our heart is here. So this is where we need to get to here. We're starting here. Start. Okay. Furthest away is going to be a vein. Right? And then we're going to go up to a venule. And a venule is going to go to a capillary bed. And then our capillary bed is going to go to an arteriole. Our arteriole is going to go to an artery. Which is going to go into the heart. Now we're going to come out of the heart. So coming out of the heart, we're going to go from an artery to an arteriole, smaller a, to a capillary, to a venule, small v, to a vein. Okay, so an oxygen depleted cell traveling from the toe back up to the heart. And then this one is oxygen rich, O2 rich. O2 poor. Does that make more sense? It's just, here, I'm gonna erase my drawings. You guys just, it's just so you guys remember. Okay, it's just so that you remember artery, right? Artery to arterial to capillary to venule to vein is the root. Okay, so I just want you guys to remember this, remember this, remember this. Okay. All right. What time is it? I don't have a clock on my screen. Okay, it is 12:13. So let's do to 1. Going from the heart to the vein is oxygen poor. Going from the heart to the vein is oxygen poor. Going from the heart to the vein is oxygen poor. Going from the heart to the vein is oxygen rich. Going from the heart to the vein is oxygen poor. It's got to go from the heart. It's okay. Hold on. Let me get out of this. Where is that? The artery takes blood away from the heart. It's usually oxygen rich, unless it's the pulmonary artery, okay, or the pulmonary vein. Oops, too far, okay. The vein takes blood to the heart. Artery away, too. So when I was doing the guy, I was just starting at the ground and working my way up. Making sense? So I'm the furthest away. So I was running back up towards the heart. And then when I got to the heart, I was running back down. So I just confused you all. Basically. Denise is gonna draw the heart for you and do the whole thing when we come back for lunch. That shows you from the little toe, the artery, the arterial, the capillary, the venule, the vein, the vena cava, the heart, okay, so on and so forth. Okay, maybe this. So, little toe, toe. Hold on. Hello? Not just yet. Okay. Bye. Artery. Arterial cap. Then vein. Okay, starting at the little toe. And then you would get the vena cava, the big vein, right? Large. And then you get into the heart. And then from the heart, you're going to go to the lung, back to the heart. Is that more clear? Yes, okay, perfect. All right, so now it is 20-ish. We'll say 20 after. We'll say 20 after. So we'll make it 1:30. Be back at 1:30. 1:30. Lunch. Yeah, don't leave. I'm gonna put your points in here real fast if you wanted points.
Hey, Mindy, are you there?
I'm here.
Are you still presenter?
It looks that way.
Okay, let me just change my name. Okay, I'm back. Hi. Do you want to start or do you want me to start?
You. Saw you.
All right. Hey, everybody. Back from lunch. I want to thank Mindy for handling this morning for me. I don't know if she told you why, but I had my grandson spend the night and I had him until 12:30. Hi, everybody. So kudos to Mindy for stepping in.
I did not tell him why, but I did tell him you were going to tell him a good story about your husband
Yeah.
later with the iliac artery.
Oh, yeah. Cool. Yes. Everyone say thank you to Mindy because I kind of sprung this on Mindy and she was not mentally prepared, but she did it anyway. So we got to thank Mindy. Thank you, Cynthia. Cynthia, I cannot wait to meet you tomorrow. Is anybody else in this class going to be in reflexology tomorrow? Oh, Eric. Oh, Christy, I love Christy. She just did lymph with me. All right, well, in case you think I'm chewing something, I am. So sorry about that. I am going to go over the route of a blood cell from the big toe and back to the big toe. Hello, Maria. Hello, David. It's Denise now. We're thanking Mindy for taking over this morning so that I could be with my grandson. And I just got in from almost a week in Sacramento or Roseville, California, helping my best friend take care of her sick mom and her sick daughter. So I've been awake a lot this week, so I'm going to try not to fall asleep on you guys. But Mindy, did you tell them about the heart this afternoon?
I didn't tell him what we were going to dissect, but I told him that I was up early and that I got something.
Oh, great. Yeah, we're going to, oh, I'm sorry about that, June. You're going to miss the heart dissection. We are going to take apart a heart, lung, esophagus, and trachea today. But you can always ask the class, you can always ask the office to see the recording and just watch the last part of the day and you can see the recording. Okay?
Okay, Gamma, don't forget to take over. Make yourself the presenter.
I am right now. All right. Sharing, presenter, grandma.
Notice she put her name as Grandma.
I put my name is Grandma today. So did they get to see the beating heart here?
No, because it won't beat on mine.
Oh,
I don't have PowerPoint.
what do you guys think?
It stopped.
Good stuff.
Close your question panel and it'll.
I am. There you go.
There you go.
Okay, so I know that Mindy went over the definitions and that she kind of gave you an overview of how a blood cell travels. And I'm going to do it now in detail if everybody's ready for that. If you like to make drawings, you'll want to be ready to make a drawing. I'm going to go to that slide.
Okay, I didn't show any videos, and I'll see you guys all around 3.
Okay, thanks, Mindy.
You're welcome.
Bye.
Bye.
Okay, I know that you guys got some of this information from Mindy, but I'm going to do it in PowerPoint form with some drawings so that you can have a sketch to go by. This is a heart, although that's not what hearts look like. This is a lung, and this is an arteriole. Okay, so you already know what an arteriole is, so let's get started. I'd like to start with the blood cell in an artery to make it uniform. All right, so did you all know the order of the way the blood vessels go? So if I were in the little toe and I started in an artery, my job now is for the blood cells to bring oxygen to my little toe. And so what vessel would I have to go into after the artery to get to the point where I need to leave off oxygen? Anybody? Okay, I'm going to open my question panel so I can see you guys. Oh, good. We have one person so far that has said, my question was, I'm in an artery in the little toe. Red blood cells' job is to bring oxygen to your cells. So obviously we're bringing oxygen to the little toe. So I asked, what vessel would the blood need to go into from an artery in order to start the setup for taking oxygen to your cells? And I have, yes, you're all answering correctly. It is arteriole. So an arteriole is a small artery. All right, good job, Joanna. That is the correct order. So now we're in an arteriole because we are branching off into a smaller artery. From an arteriole, what do we connect to? Yes, a capillary. Now, in this capillary, the blood starts as oxygen rich, correct? And as it slowly passes through, it becomes oxygen poor. So I have depicted that in my flow chart here, that we're going to go from an arteriole to a capillary, and as the blood cells going through, it stays red because it's oxygen rich, but then it drops its oxygen, and now the blood in the capillary is oxygen poor, okay? It is now oxygen poor. So seeing that a red blood cell's only job is to take oxygen to your cells of your body, we've now done the job. We've passed through a capillary bed. We've dropped off as much oxygen as we possibly can fit into the interstitial fluid. Where is this capillary going to connect to on the other end? Great, a venule. So that venule is going to be oxygen poor. And then from a venule, we're going to go to what? Exactly, a vein. Now, we're still in the little toe. Okay, does everyone understand that? We're still in the little toe. We've gone from a larger artery to a smaller arteriole to a very tiny capillary, then out of the capillary to a venule, and now to a vein. Mindy said there might have been some confusion about now how does it get to the heart? Is that correct? Okay, so I'm going to change pictures for just a minute, okay? After I did it, goes automatically to you, or I have to send it to you? Erica, what are you asking, honey? What are you asking? Let me find out what Erica's asking here. Well, I don't know what Erica's asking. Okay, so I'm going to change slides because right now we're still in the little toe. Okay, we came all the way down from the heart through larger arteries down to smaller arteries. Well, now we have to get back to the heart. So I'm going to change pictures for just a minute. Okay, I'm going to go to this page because this page shows both some veins and some arteries. So we'll pretend we're down here in the little toe, okay, with a very small vein because we just took oxygen to cells in our little toe, okay? And you see how all of these veins have different names? All of these veins have different names. Can you all see that? So as veins, okay, as veins, and we're starting in the little toe. As veins return blood to the heart, they start out really tiny because they just came out of a capillary, let's say. But then it heads into a larger vein, and then maybe it'll travel up here. Maybe it'll travel up the popliteal vein, or maybe it'll travel up the anterior tibial vein. And as the veins are going up, they're going to get larger, and then they'll connect to maybe the popliteal vein and the femoral vein, and then the iliac vein. Okay, and then they'll travel up the inferior vena cava, and you'll see that as the veins are getting closer to the heart, they get bigger and bigger and bigger and bigger, which with arteries, it's the opposite. Arteries start with the heart. The aorta is the largest, and they come out and they get smaller and smaller and smaller as they get further away. And of course, not all the smaller arteries are shown here, or not all the smaller veins are shown here. But what I'm trying to show you, it's kind of like it's kind of like a tree with branches, and the trunk is the largest. And then as you move away from the trunk, you go into, a branch and then twigs and then little twigs. Our arterial and venous system works the same way. So if we were to get super detailed on our flow chart, once we got into a vein, we might give it a name, like maybe a dorsal vein, and then the dorsal vein will go into the posterior tibial vein, and then the popliteal vein, and then the femoral vein, and then the iliac vein, and then we have we head up here through the inferior vena cava, and then we get to the heart. Okay, and then once the blood goes through the heart, it's going to come out the aorta, and then depending on where it's going, you can head down the aorta to the iliac, back through the femoral, the popliteal, the tibial, and then right back down to the foot if it wanted to. Or it might travel out to the arm. The blood cell doesn't really care where it's going to go or what path it takes. So yes, so Raquel is asking, the veins and arteries get bigger the closer to the heart they get. Yes. Yes, when an artery enters the heart and when an aorta leaves the heart, that's the largest that they are, is when they connect to the heart. When they connect to a capillary, that's the smallest that they get. But they have to gradiate down or they have to grow up, depending on whether we're going through the venous system. So if you just think of venous return, as the blood cell is traveling back to the heart, the veins are getting bigger and bigger and bigger. As a blood cell is leaving the heart, the arteries are getting smaller and smaller and smaller and smaller. Does everyone get that concept right now? Thank you, Matthew, Cynthia, June, Raquel, thank you. Okay, so I think that was the missing piece this morning, is that we're not going to name them all in our flow chart, because we'd have to go through several. Vein, 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 till we get to the vena cava. Aorta, artery, 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 until we get to an arterial. So we just stay with artery and we just stay with vein when we do our drawing, okay? All right, so I'm going to go back to our drawing and get us back where we were. Okay, we're still in the little toe. So we know now that we have to travel up all the veins in the leg, all the veins in the trunk, until we get to the biggest vein in the body. Can anyone tell me what the biggest vein in the body is? It's the one that goes into the heart. It's the vena cava. Yeah, remember vein, vena cava. Aorta is an artery. So think about the word vena starts with a V and the word aorta starts with an A. Okay, aorta for artery, vena cava for vein. Okay, all right. So you're right. Who can tell me which side of the heart the vena cava enters? Yes, the right side. So here we go. Yes, the right side of the heart. So here we go. We have the right side of the heart. Let me see what color pen I have. Pen. We'll go with blue because it's the oxygen poor side. So we're going to draw our right atrium and we're going to draw our smaller right ventricle. All right, so we have right atrium and right ventricle. And we have vena. Now, of course, this isn't exactly how it goes, but I want this to be simple for you. So we're going to depict this like the shape of a Valentine's heart with the vena cava coming in, pulmonary going out, aorta and everything like that. Okay, so we come into the vena cava and we go through the right atrium. Okay, now we have oxygen poor blood, we know that. And then we go into, from the vena cava, we know we've entered the heart now, and we're in the right atrium. Now, on your homework, did you have to mention the heart valves? Did you guys talk about the heart valves? You didn't talk about the heart valves? Okay, good. So Corey is writing tricuspid, pulmonary, mitral. Excellent. So it was on your homework. So we're going to throw it into the lecture right here, okay? Your first heart valve is between the right atrium and the right ventricle. And I'm going to use green for the heart valves. And it looks like it has it has strings on it. So the valve on the right side, who knows what the right valve is? If you guess tricuspid, then you are right. So this little valve here is in between the right atrium and the right ventricle. I'm pretty sure on your homework it said to name the 4 heart valves. Did it? Can someone confirm for me? Okay, thank you, June. It did. Good. Okay, good. If you missed it, that's okay. You can put it right here. So the tricuspid valve goes in between the right atrium and the right ventricle. Right, you didn't go over it in class yet. What's interesting about the tricuspid and the bicuspid or the mitral valve is that and you'll see in the heart today, we're going to dissect a heart at the end of class. They actually have strings that are called chordotendae, and chordotendae means heartstrings. So when we have the phrase that something is pulling on your heartstrings, we come by that naturally because the heart valve actually has strings in it, and we'll look at it later in the dissection. So the valve in between your right atrium and your right ventricle is called the tricuspid valve. From the tricuspid valve, we jump our blood into the right ventricle. And notice that I drew the right ventricle smaller and I drew the left ventricle. And there's a great big reason for that. But for right now, we're just going to draw our thin muscular wall. Trying to color it in. Well, this is the muscular wall of our right ventricle. Remember that the heart is made of cardiac muscle. So it was the third type of muscle in your body after skeletal and smooth, which made up your organs. Then we have cardiac muscle, which was a beautiful combination of smooth involuntary and striated involuntary muscle. Okay, now the right side of the heart is what pumps oxygen poor blood. So where do we need to go from the right side of the heart? Yes, Corey is saying yes. Okay, so Cynthia is telling us that we're going to go through another valve, which is totally correct. We have another valve we're going to add to our list, and that's the pulmonary valve. Like I said, I'm not drawing this to life scale, so don't hold me to it. We're drawing it so that you'll remember all the things. So I'm going to put the pulmonary valve right here. And then we're leaving in another blood vessel because we need to get to the lungs to get oxygenated. So who can tell me the name of this blood vessel? So if it's a large blood vessel leaving the heart, do you think it would be an artery or a vein? If it's leaving the heart, is it a vein or an artery? It is an artery. So you're correct. Since it's going to the lung, it is the pulmonary artery. Let me add that to our flow chart. Yes, so this is the time where an artery carries oxygen poor blood. Okay, oxygen poor blood. Someone put a question mark, let me know. Yeah, pulmonary, you had the right answer, pulmonary artery. So now we have to go through the process of taking the carbon dioxide that's on our red blood cells now, because isn't that the byproduct for oxygen, right? The byproduct of us breathing in oxygen is that we breathe out carbon dioxide, CO2. And so we need to go through a process within the lung in order to get that oxygen renewed. So if we're in the pulmonary artery, we need to get down smaller again, just like we did up here. We need to get down smaller again. And so if we went from a pulmonary artery, what would we do? Oh, I just told you. Of course, we'd go down to a smaller artery, a smaller artery, and a smaller artery, but then we'd eventually get down to an arteriole. Does everyone understand that? Just like we did going up back to the heart, the veins got bigger and bigger. When we're in the arterial system, they've got to get smaller and smaller and smaller until we get to an arteriole that's in our lung. So these are all little alveoli, but luckily I drew an alveoli over here So I'm going to make a few drawings, and you start thinking about oxygen getting moved in and out of your body. Okay. So what are these that I'm drawing about around the alveoli? Who can tell me? No, they're capillaries. So I'm going to change pictures again for a second, just to remind you. Okay, so here is a big giant alveoli. Here's a little alveoli bed, okay? So here's the arteries coming down. And then, I'm sorry, not the arteries coming down. Here's the pulmonary capillaries here. So these are venules, capillaries, and arterioles that are, no, Raquel, that goes up through the veins. Were you here when I first started class? So so when you think about blood going back to the heart, if you remember that is called venous return, it's veins that take blood to the heart. It's arteries that take blood away from the heart. So if you write that out, if you write out veins take blood to the heart, okay? Veins take blood to the heart. Arteries take blood away from the heart. I know it's confusing. Good, yeah. Arteries, think of artery for away and veins for venous return. Arteries take blood away from the heart, veins return blood to the heart. So this is a capillary bed here, that are surrounding all your alveoli. Okay, so when we start, we go through a venule, through a capillary, through an arteriole. Okay, so if we go back to our slide that's in our lung, so from an artery in the capillary, we would go into around an alveoli. And so when your blood cells, so here's a capillary, let me get another capillary here. Okay, so let me stop and finish this question with Raquel. Yes, Raquel, that's the perfect order. Artery, arterial, capillary, venule, vein. Yes, that's the order. And that order never changes, but that order could be in your little toe, or that order could be in the lung. It never changes. So when we have the whole, when we have this whole list done, it'll be a little clearer. That is the order though. So right now we've gone from a pulmonary artery to all the way down to a little arteriole. And then the whole reason your blood goes to your lungs is so that it can, because it starts as oxygen poor, and as it goes through the capillary, it gets renewed with oxygen. But the byproduct of oxygen, you know, is carbon dioxide. And so when the blood cells first enter the capillary, they're oxygen poor, okay? Because they contain CO2. And then what happens as they travel through the capillary is oxygen that's waiting. When you take a deep breath in, oxygen is stored inside this alveoli, and the oxygen jumps in to the capillary, and the carbon dioxide jumps out and goes into the lung. So they basically just change places, which is called simple diffusion. It's amazing that the most complicated thing we do, okay, Raquel, I'm saying it goes up via vein to an artery. No, I didn't. No. So if you look at this list here, the little toe, it's in an, I'm going to clear this up for Raquel and then go back. The little toe, it's an artery. Then an arteriole, which is a little artery into a capillary. It leaves the oxygen in your little toe. And then it goes to a venule, then a vein. And then it's going to travel all the way up your leg and your trunk into the vena cava, which takes it into the right side of the heart. And that's where we are over here. So this is a vein. All the way up till here, it's a vein. But then the blood needs to go to the lungs to get oxygenated. And whenever blood leaves the heart, it's in an artery. So that's why when it's leaving, it's in an artery. But when it comes back, it's going to be in a vein. Okay, but when it leaves the heart, it's in an artery, and that's here. So here it's coming into the heart. Oh, I need a pen. So the blood is traveling this, oh, why won't the pen work? The blood is traveling in this way and then out this way. Does that help? Okay, so it's coming in a vein into the right atrium, into the right ventricle, and then it leaves the heart in an artery and it goes to the lung. This is the lung right here. All right, now, so we're good up until there. When it goes into the lung, it's got to go to a smaller arteriole and then into a capillary. And those capillaries are what surround your alveoli, which is your air sacs. So this is an alveoli. So this is an air sac, which are just kind of microscopic in your lungs. You have like 150 million in your lungs. And this is where it picks up oxygen. So it goes from, in the lung, it goes from the pulmonary artery all the way down to a smaller artery into a capillary. And then where's it going to go from a capillary? It's going to go to a venule, and now it's red, so which means it's oxygen rich. It's still in the lung, and it's in a very tiny vein. But as we travel through all the veins, right? As we travel through all veins, we're going to get larger and larger. If you remember the picture, we're going to get larger and larger and larger as we get back to the heart. And then we're going to rejoin the heart. And this time we're going to rejoin the heart with oxygen-rich blood, which would be red. Now this is also a vein. And why is it a vein, guys? Because it's bringing blood to the heart. So what would this vein be called? Well, no, the vena cava is on the right side of the heart. So what's the vessel on the left side of the heart? Remember, it's coming from the lung. So if we have a pulmonary artery, wouldn't we also have a pulmonary vein? Wouldn't we also have a pulmonary vein, guys? Do you remember that when Mindy did? No, the aorta is a artery, so it's leaving the heart. So yes, Cynthia is correct. If we're coming back to the heart, it's going to be in a vein. And so the next vein is the pulmonary vein. So remember, you have a pulmonary artery, which takes blood away from the heart to the lung. And then you have a pulmonary vein, which is taking blood all the way back. This is a bad drawing, but it's taking blood all the way back, then through the top of the heart. Because remember, it's veins that bring blood to the heart. Blood enters the heart in the top. Blood enters the heart through the atrium, and it leaves through the ventricles. Okay, Corey's question. Is the alveoli exchange taking place in the capillary of the lungs? You want to think of it this way. The capillaries of the lungs are surrounding the alveoli. Does that make sense, Corey? Okay, the capillaries, if you remember that picture, they're actually surrounding the alveoli. They lay around it, like I'm trying to draw here. They lay around it. And it's simple diffusion. So when you take a deep breath in and your lungs expand, they're expanding because you're filling your alveoli with air. So they're getting bigger. Okay, and when they stretch open, it allows the capillary exchange of oxygen and carbon dioxide to happen. So the oxygen that's in your lungs hops into the capillary. The carbon dioxide that's in your blood hops back into the alveoli, so that when you breathe out or exhale, you exhale all that carbon dioxide, which is what plants breathe in, and they turn it into oxygen for us. Okay? They turn it into oxygen for us. So, so for Raquel, whatever's returning to the heart is never in an artery. It's always in a vein. So from the little toe, it travels through a venule, and then a bigger vein, and a bigger vein, and a bigger vein, and a bigger vein, until it gets to the vena cava, which is also a vein. And then it travels through the right side of the heart, and then it goes to the lung, and it travels in arteries when it leaves the heart. Okay, pulmonary artery through the lung, and then in a pulmonary vein, because veins return blood back to the heart. And then who can tell me the name of this chamber of the heart? Left what? Yes, left atrium, left. I'm going to do my drawings first and then so left atrium, because this is the right atrium, which is going to make this the left ventricle. And I'm going to make the walls here quite a bit thicker. Okay, pretend that. Okay. Left atrium. So it doesn't necessarily follow artery, arterial, capillary. Yes, it does. That never changes. When blood is in vessels, it always goes artery, arterial, capillary, venule, vein. That's okay, that's okay, you guys. When you're confused, I just want to help you. I just want to help. When you're in a blood vessel, it always goes artery, arterial, capillary, venule, vein. The only time that changes is if it's going through the chambers of the heart. That's all. Okay? Yes, exactly. I'm saying that blood goes up small veins and they get bigger and bigger and bigger until they get to the vena cava, and that's a vein. And then it enters the heart, and then it goes to the lung, and then it comes back to the heart. So the artery is here, pulmonary artery, when it leaves the heart to go to the lung. Here's the artery, because arteries always take blood away from the heart. Now, when it leaves the lung, it goes in a vein. No, there's no artery till it leaves the heart. Yes, there's no artery till it leaves the heart. Exactly correct. See, you're getting it. It's okay. You're absolutely fine. Okay, so here's our capillary bed. We collected oxygen by simple diffusion. We went from an arterial to a capillary to a venule. And then we went to the pulmonary vein, to the left atrium, to the left ventricle. So let me get that on our list. So now everything is oxygen rich, pulmonary vein. Took it into the left atrium. And then here's our next heart valve. Our next heart valve is the bicuspid valve, also known as the mitral valve. So they could be called either one. So we have another heartstrings here. Really cool. We're going to look at these later inside the heart. So that's our bicuspid or our mitral valve. And then we're going to go from there, we're going to go to the left ventricle, which is where we are right now. Okay, so our drawing is showing everything that's in the list right now. So does anybody notice the difference between the really thick left ventricle, the muscle wall, the size of the chamber, and then the right ventricle being smaller and a thinner wall? Can anybody take a guess why that would be? So the left ventricle, yeah, Corey is saying the left ventricle has to be strong. And why is that? Yes, exactly, because it has to pump blood to the entire body. How far does the right ventricle have to pump blood? Only to the lungs, right? Only to the lungs. So that chamber does not need to be super strong. So yes, you are all correct. The left ventricle of the heart has a thicker wall of muscle and it's a larger chamber because it's pumping it out to the entire body. Excellent. Okay, so now we got to get back to the little toe. And so we have one more valve. We have one more valve. So let me get a little green color. So we have one more valve. We'll put it here. Okay, who knows the name of this last valve? So we have tricuspid, bicuspid, pulmonary valve. Who wants to guess the name of the last one? Good job, guys. The aortic valve, because it's connecting to the aorta. So there you go, connecting to the aorta. So the aortic valve. Okay, so arteries are what take blood away from the heart. So what's going to be our vessel? What's going to be our next vessel? And now we're leaving the heart. So what's the largest artery you have? This is going to be the biggest artery you have. The aorta. Good. Now, our aorta has two branches, just like the vena cava does. So you have a branch that comes up behind the heart and a branch that that goes down. They are connected, and I'll show you a little bit in the drawing, but we have the aorta. So we have a branch that goes up to the head and becomes the carotid arteries. And then we have a branch that comes down and breaks off into the iliac arteries. Okay, so the aorta is the largest, it's actually the largest blood vessel in your body, but it's also the largest artery in your body. Remember that no matter where the vessels come from, if they're leaving the heart, they're an artery. If they're leaving the heart, they're an artery. If they're entering the heart, then they're a vein. So we go from the aorta. So if you remember the picture I showed you of the aorta, we would come, let's say we're going to go back to the little toe. We would go down what? A series of larger to smaller arteries, correct? We'd go down the aorta to the iliac, to the femoral, maybe to the popliteal, and we get right back to the little toe, which puts us back in. From the aorta, we're going to go down a whole bunch of arteries till we get to the one in the little toe. And there we go. That's the end of our chart. Now, we could go to our hand or we could go anywhere, but the question was, how would you describe the route of a blood cell from the little toe through the circulatory system and back to a little toe? And this is how we would do it. Is there a secondary name for tricuspid? No, there isn't. No, there isn't. And I don't know why. The mitral valve has a secondary name because it looks like a mitre, the hat that the Pope wears, a three-sided or two-sided, a mitre. I think that's where bicuspid or mitral valve comes from. So if we were to change pictures here, oh, I know. So Corey, you were asking, I hope you can see past the drawings. See how the capillary beds surround all the alveoli? This is what an alveoli looks like over here without capillaries around it. But this is how it looks with the capillaries. And you can see the blood vessels here going around the walls of the alveoli. Okay, June, see you later. See you next week. So yes, the red blood cell starts from the little toe and it goes into a venule and then a vein, and then it travels all the way up to the vena cava, goes through the right side of the heart, goes to the lungs, travels in a vein back to the heart, goes through the left side of the heart, leaves in the aorta, follows the arteries all the way down and back to the little toe. Yes, I can go back. I was just wanting to show, some pictures, but I'll come back. Okay. So if you write down or take a screenshot of this order, so Raquel, if you notice on the list, we start here with artery, arterial, capillary, venule, vein. The vena cava is also a vein. Then we go through the heart, right? And then we start again with artery, arterial, capillary, venule, vein. And then we go back in the heart. And then we start again with artery, arterial, capillary, venule, vein. Then we go into the heart. And that order never, I guess the point I was trying to make is that order never changes. Because a red blood cell's only job is to bring oxygen or get oxygen. And so that is why. Yes, there are arteries in the little toe. Raquel, there are. So we're down here in the little toe. This here, I'm gonna circle something for you. All of this is in the little toe. This is just a little artery, and then a little arteriole, and a very tiny capillary, a little venule, and a little vein, okay? We're still in the little toe. But when we leave this vein, before we get to the vena cava, we travel through several veins that get bigger and bigger and bigger and bigger and bigger as we get back to the heart, okay? And then we go into the biggest vein, enter the heart, go to the lung, and then we leave the heart in the biggest artery, and we travel down arteries as they get smaller, smaller and smaller. Your legs, your arms, your head, your trunk, everywhere you have blood, you have arteries. It just depends on the size. But you have arteries and veins everywhere. But if they're way down in your feet, they're small. If they're in your distal leg, they're a little bigger. If they're in your thigh, they're a little bigger. When they get to your trunk, they're even bigger. And when you get to your heart, they're the biggest. Same thing within your hand. In your hands, the arteries and veins are small. But when you get up to your distal arm, they get bigger. They get bigger in the upper arm. Then when they enter the chest, then when they get to the heart, they're the biggest they are. Same in your head and your brain. Your brain is full of capillaries and then arteries and arterioles and venules and veins. The farther they are from the heart, the smaller they are. And as they move back towards the heart, all arteries and all veins get bigger. Does that make better sense? Okay, good. Okay, does anybody have any questions on this one? That's fine. I just want to make sure that you are not too confused before we finish the day. Okay, is everybody okay with me erasing this drawing? Gosh, Mindy's going to be here in about a half an hour. All right. So this is the 4 heart valves, but you guys drew them. So everything comes and goes from the top of the heart, even though I told you I was drawing it the opposite way. But you have this all on your picture. I'm going to see what's next. You're welcome, Alexandra. Let me see how much we have left. Okay, we've been back to class for an hour. Let me tell you what we're going to do. I'm going to leave this slide up and we're going to take a very short break, like 10 minutes, while I set up the table for the dissection and you guys write this down, okay? So maybe what time is it? 2:32, we're going to take an 8-minute break, okay? We're just going to take an 8-minute break till 2:40. Okay, and I'm going to set up the table for the dissection, and you guys can write this slide down if you'd like, because I'm sure some of you would like to write it down. Okay. All right, we're back. We're going to go through our rest of our slides and get ready for our heart dissection when Mindy gets here. Oh, I know. I was supposed to tell you the story. Okay. So I'm going to go back to a picture. I'm going to go back to this one. Okay. So, so here we can see we have the aorta, branches up to the top and then comes down. And then right here, it bifurcates. This is what's called a bifurcation. And it splits into an iliac artery and an iliac artery. Okay, so we have that whole we have the ascending aorta and the descending aorta. So when we do compressions on someone's abdomen, we feel the beating of the descending aorta. Okay, because you can see it comes right down the center. Okay, so long before my husband's diagnosis with cancer, he was having nerve pain down his legs. And it was really, really difficult for him to walk very far. And he was a handyman by trade, so he had to walk all the time. And we tried, we went through all the medical tests that medicine can think of, and did physical therapy, did nerve testing. But when he would attempt to walk, it wouldn't take very long most days, and he would get nerve pain and burning pain down both of his legs, much more on the left than he got on the right. And so after 2 years of chasing this cat that we couldn't catch, I remembered seeing an exhibit in the Bodyworkers exhibit where they showed the dissection of a smoker's leg and what happens to the arteries in a smoker. And so we went back to his doctor and I asked if they would do a vascular test. And the doctor said, why? And I said, well, Kevin's been smoking since he was a teenager. And I wonder if there's arterial damage. And so he would go through short periods where he'd be better, and then he'd get worse and get better and get worse. And so they did a vascular exam, a live one, and you could see in the film that when the blood came down the descending aorta, there was no blood coming down the iliac arteries, some over here, but some over here. But what had happened was your body can build what's called collateral arteries and veins. And what his body had done during those periods is, because there was 100% blockage down this iliac artery, almost inches of solid, clotted, fibrous mass. And the leg was starving for oxygen. So what the body does, and the heart can do the same thing, is it will build an artery to go around the clot. It will build an artery to go around the clot because the leg just wants to live. Well, by the time we got him to the doctor and had the vascular study done, his body had built 11 collateral arteries to bypass this clot. It was enough to keep his leg alive, but it was enough to keep him in pain. And the other side was 50% occluded. So half of the iliac artery was occluded. So what they did is they went in and they put stents in, the same as they put in someone's heart, and they had to tear open the fibrous clot because it was all solid. And they went up through his groin right here, and they went in with a balloon and they ripped open his artery, and then they put in metal stents. I'll show you a picture of one later, but they're kind of like the old spring in an old click pen. And they would rip it open and they would put the stent in. And all in all, they had to put 1 here, 3 here, or 4 here, 1 here to keep it from collapsing, and 2 or 3 on this side. So by the time he was done, he had 7, 4, 5, 6, 7. And the stents were about 3 inches long. Yes, and that was all from smoking. Okay, and it doesn't matter what you smoke, whether it's pot or cigarettes, because Kevin smoked both. It ruins the walls of your arteries. It's not just, vape is the same thing. Vape is actually worse. Vape is actually worse. There's a new vape disease out there because vape is so much harder on your lungs than the actual smoke from tobacco. Yes, do your research. Teenagers are dying from vaping more faster than adults ever died from smoking cigarettes. Vaping is much more dangerous. So I don't care what anyone tells you. So anyway, that's what happened to him. So we had these collapse. So your body is gonna fight to live, and it can actually build arteries. It can build what's called a bypass or a collateral. And I saw it in my own husband because when we watched the live exam, the blood came out of the heart, came down, you could see the blood flow, and then it was spread out in 11 different directions. So Joanna's commenting that she's seen it at work in young kids coming into the ER with collapsed lungs from vaping. So spread the word, collapsed lungs from vaping. Your lungs just can't take that. They were not meant to breathe in that crap. All right. So that's my story that Miss Mindy said I was going to tell you. And it's too bad that it took so long because 3 months after they fixed it, he was diagnosed with lung cancer. So it was a little too late. Okay, so we learned how blood becomes oxygenated, that the diffusion happens in the pulmonary capillaries through the alveoli. So oxygen goes into the alveoli because it's less concentrated in there, and carbon dioxide moves back in out of the blood because it's less concentrated in there. So they simply exchange places. Okay, so the alveoli in the lungs are surrounded by capillaries. And when they wrap around the alveoli, it's simple diffusion. Oxygen and carbon dioxide simply change places. You're welcome for that I shared. Okay, is everybody done here? Okay, we're going to zip through these FYIs because Miss Mindy's going to be here. All right, how do the diaphragm, scalenes, and intercostals assist in breathing? So here we have pictures showing scalenes, sternocleido, pectoralis minor, serratus anterior, external intercostals, diaphragm, rectus abdominis. So we're going to look at, these are all considered muscles of breathing because how they help to move the rib cage, number one, how they help to hold down the rib cage, how they help to push breath out of your lungs. So the diaphragm first, because it is your main breathing muscle. So your diaphragm kind of looks like a parachute when you're at rest. It's rounded like a parachute. It sits underneath your heart and your lungs. It's actually what separates your abdominal cavity from your thoracic cavity where your heart and lungs are. So it is the separation between those two, and all the blood vessels travel up through it, and all the lymph vessels. For those of you that just took lymph, remember that the thoracic duct travels right through the diaphragm, and that's why deep breathing helps to move lymph. So on the extreme left, when you're at rest, you have this curve in the diaphragm is considered relaxed. When you take a deep breath in, you can see the diaphragm flattens out. And what it's doing is, number one, it's helping to create more space. So it's contracting down when you breathe in. And it also creates a vacuum effect, allowing or sucking the bottom of the lungs down so that they can fill with air. This is why diaphragmatic breathing is considered so healthy, because the more you contract the diaphragm, the more oxygen you're actually bringing into your lungs. Okay, so the deeper you breathe in, the more the diaphragm contracts. Yes, that's how babies breathe. They always have those big fat breathing bellies. So the diaphragm contracts, pulls down, creating a vacuum effect. I think that's supposed to be effect on the lungs, drawing the air in. The scalenes, of course, they're a structural muscle because they flex the neck. They flex the neck, but during forced inspiration, so if you put your fingers just on top of your clavicles, close to your throat, and breathe in really hard, you should feel your scalenes pulling up and contracting. And what they're doing is they're raising the first two ribs to help give more room inside the rib cage for the lungs to fill up with air. Okay, so you'll see overdeveloped scalenes in runners, people who do sports where they're just heavily breathing all the time, but you'll also see overdeveloped scalenes in people with breathing issues like asthma and COPD, emphysema, because they're struggling to breathe, and in that struggle, their scalenes become really overdeveloped. The intercostals, first of all, the 3 sets of abdominal muscles, not the rectus abdominis, but the internal obliques, external obliques, and transverse abdominis, those muscles keep going up the rib cage and they actually become the intercostal muscles. So intercostal, it means in between ribs. And so if you know the directions, you know how the 3 abdominal muscles, all the fibers go in different directions. Well, they match the 3 layers of the intercostal. So the external layer, when you breathe in, they lift and expand the ribs. And while the internal layer, when you exhale, contract to close the rib cage. The third and innermost layer doesn't go all the way around, but where it does go around, it helps to bring the rib cage down. So intercostals lift, and the internal layer let it release back down. Someone asked me to go back to the diaphragm page. Hopefully it's quick. All right, everybody good here? All right. Rectus abdominis and quadratus lumborum. You see how the rectus abdominis goes from the pubic bone to the bottom of the rib cage and the xiphoid process on the sternum. So in someone who's breathing properly, they actually do pull in their stomach muscles in order to help push the air out. Quadratus lumborum, being attached to the 12th rib, actually anchors the bottom of the rib cage so that the rib cage can expand and move upward. And I tell my clients who come in with low back spasm, I have them take the biggest breath they can. And if they take a nice deep breath and it doesn't hurt them because of the pulling on the rib cage, then the problem is most likely not quadratus lumborum. Okay, so that's a little test that you can do. All right, are we ready for FYIs and pathologies? What I said was, when a client comes in with extreme low back pain, I have them take a nice deep breath, as deep as they can. And if it doesn't make their low back hurt, chances are that the muscle in question is not quadratus lumborum. Not. Because when you look at how it's anchored, okay, when you look at how it's anchored to the rib cage, if their low back hurt and quadratus lumborum was in spasm, and they took a nice deep breath, as big as they could get their tummy to be, and it doesn't hurt, then chances are it's not quadratus lumborum. Okay, bypass surgery. So here we have a beautiful heart from the Bodyworkers exhibit. He put silicone into the arteries of the heart. So there's no veins here. This is just the arteries. And then he used acid to melt away the rest of the heart. So this is really, should they be standing? Probably. So this is just the arteries of a real heart. So you can see these large coronary arteries. It's the coronary arteries that bring oxygen to the heart muscle. Because when you think about it, if the right side of the heart receives oxygen poor blood, then obviously the blood that goes through the heart is not what feeds the heart. Okay, it's not what feeds the heart, it's the coronary arteries that feed the heart. So these are large coronary arteries right here and here. You have just so many, I think 6 maybe? Maybe 4. I don't know. Cynthia, do you know how many coronary arteries we have? Okay, so a bypass. So a bypass might be needed for a couple of reasons. Either there's a blockage in one of the coronary arteries, and if there's a blockage, that means oxygen is not getting to its destination. Okay, it's fine if an artery has a blockage, but we have 8. Thank you, Miriam. We have 8 coronary arteries. So blood is traveling from the aorta to the coronary arteries. And then you see these smaller arteries going all the way down to little arterioles and then capillaries. Well, if one of these arteries gets blocked, we have to do a couple of things, and one thing might be a bypass. So right here, we're showing where there's a narrowing. Right here or here, there's a narrowing in a coronary artery, and blood is not getting to where it needs to go, and this person is passing out, or maybe they've had a heart attack. Wow, she said that her mom had bypass and all 8 coronary arteries were blocked. She's lucky she was alive. So the blue is showing a vein and the red is showing an artery. The most common way to do a bypass is for them to cut open the whole inside length of your leg and take out the biggest vein in your leg, called the great saphenous vein. And they'll cut that out, and then they'll take it up and they'll sew it to the aorta, and then they'll sew it to the other side of the blockage so that now the blood can flow from the heart all the way down to where past the blockage. This picture is in red because sometimes they use an artery from your arm. When they take it from your leg, it's a big vein. If they take it from your arm, it's an artery. And so they'll sew it right to the aorta and then to the other side of the blockage. That's what a bypass is. Okay, Mindy's here. I'm asking her if she's scared to come in with the dogs. All right, let me go to the next slide. All right, and so this is what my husband had. So angioplasty. So here's arteries that are blocked by plaque. Okay, we can see the plaque here. And the plaque is narrowing and it's causing blood to not be able to get through. And so they stick in this, they go through this catheter and it has this stent on it. And there's a balloon inside the stent and they blow it up. This is what they did with my husband. They blew it up and then they pull the catheter out and then this stent holds the artery open. Okay, they might do this in the heart. They did this in my husband's legs. Okay. Yeah, well, the brain and the kidney, they can do, yeah, they can open up arteries and veins. They do it, yeah. Angioplasty. All right, so arterio and atherosclerosis is next. And this is also known as hardening of the arteries. So anything can damage the walls of arteries. The main damage, of course, is going to be from high blood pressure, diabetes, smoking. Those are the three top causes. Viruses can also attack the walls of your arteries. And two things can happen. In arterio, the wall of the artery is becoming thicker. In athero, which they are pretty much the same thing, in athero, you've got plaques that develop from high fats and cholesterol, and they adhere to the walls of the arteries, and they damage the walls of the arteries, and then the walls of the arteries, because they're damaged, your body sends platelets there to clot the blood, and then it builds on top of the plaque and then eventually causes damage to the walls of the arteries. So you can see here, blood clot is forming, the plaques are here. Anything that damages the walls of the arteries. So arterio or atherosclerosis is known as hardening of the arteries. I saw on the Dr. Oz show one time that he said that if you can't bend over, that it could be a sign that your arteries are so hardened that they won't stretch and let you bend over. So ever since then, I've been bending over every day to make sure I keep my arteries stretched. All right, an aneurysm. An aneurysm is a weakening in the wall of an artery. The reason we're showing the brain is because this is the most common. People do get aortic aneurysms, and 99 times out of 100, they die if an aortic aneurysm breaks. But the most common spot is when you have a ballooning of an arterial wall because the arterial wall gets weak. And again, diabetes, smoking, high blood pressure, obesity can all change the walls of your arteries. And so if the walls become so weak that the pressure of the artery balloons out the wall and becomes an aneurysm. Now, an aneurysm can be there. I knew a woman that had 2 aneurysms. They were there the moment her eggs split when she was in utero, but they didn't break till she was 55. But when the one on the left side of the brain broke and they did a brain scan, they found that there was an exact replica on the opposite side of the brain on the same artery, which means they were there when her egg was forming in the uterus with her mom. But she had the aneurysms her whole life before one of them burst. When one of them bursts, it's going to cause a stroke, and that's what we're going to talk about next, is a stroke. So we have 2 types of stroke. Stroke means death from lack of oxygen. Death from lack of oxygen. So we have 2 types of stroke. We have an ischemic stroke that's caused by a clot, and the clot hits some plaque and it stops blood flow. The other way is a hemorrhagic stroke caused from, if this were to break, if this aneurysm were to break, blood would then flood the brain, but it wouldn't get to its destination. So that's a hemorrhagic stroke where they bleed. And sometimes if there's enough blood, it also damages that part of the brain. So either way, whether it's an ischemic stroke or a hemorrhagic stroke, the part of the brain that dies is the part of the brain that did not receive the blood. Okay, it did not receive the blood. That's the part of the brain that has the stroke. So depending on what part of the brain that was, is what someone's symptoms might be, whether they're going to be paralyzed, lose their ability to speak, lose their ability to understand or say language or read a book or whatever, whether they're going to be weak on one side. It all depends on where the stroke happens. So here's something you're never going to massage. Okay, varicose veins, varicose veins. If you remember that the walls of veins they do have smooth muscle, but the smooth muscle is very thin. It's not thick like on arteries, it's very thin. And so people who stand on their legs all day, like massage therapists, people who smoke, diabetes, all the same risk factors that we had for stroke and bypass and arteriosclerosis, they cause a bulging in the wall of the veins. And you can see the pieces of the veins that have overstretched so much that you can see the blood really close to the surface of the skin, and they kind of get bumpy and craggly. Well, depending on how big and deep or how big these are, there can honestly be breakages in the walls of the veins that would cause the blood to clot. And the reason we want to stay off of this kind of varicosity is because there could be a blood clot there ready to be dislodged and move on to the lungs. So that's the possibility. So gentle circulatory, like effleurage, is probably okay, but you're never wanting to put deep pressure on these type of veins that are raised and bumpy. Okay. Is there a way to fit? Ashley's asking if there's a way to fix these veins. There's pretty extensive surgery that's called stripping of veins. When you just have spider veins, or like these out here, they inject saline in to make them look better. And I believe there is vascular surgery that can be done. I'm just not sure how extensive it can go. So, so hold on, you guys, 1 second. So to the right of my stove is all my Cutco knives. In that same thing is the Cutco scissors. And then underneath my bathroom sink in the cow bathroom downstairs, probably some gloves. Mindy's here with the heart. So spider veins are these little tiny red ones that are very superficial. These are called spider veins. So this one, a little bit more superficial where they're before they've, really become big. If they had vein surgery, could you then massage their legs? Yeah, I mean, I'd make sure it was okay with their doctor. For sure. But yeah, if all these bumps and stuff go away and they're not at a risk for a deep vein thrombosis, which is deep vein clotting, then you should be okay. Yes, you can massage spider veins. I'm only telling you that these raised, when they have these big bulgy, like this right here, and this right here, and a little piece here, these are the ones you have to stay off of, massaging deeply, okay? All these other ones are fine. But when they start raising, and if they have pain in their legs, most of the time when they get big and tear like this, they have pain in their legs. So you want to make sure they don't have pain before you massage them. We are seeing a pig heart, and I think we have a heart, lungs, esophagus, and trachea. My ex-mailman is butchers his own animals, and I called him this week, and he butchered 2 pigs yesterday. So I haven't seen them yet. Mindy just got here with them, so I'm going to finish these FYIs and then, or maybe Mindy can finish the FYIs and we can get set up with the heart. Let me see what we have left. So caffeine. So the effects of caffeine on the arteries in your body, the effects of caffeine are that they contract the smooth muscle and they close your arterial walls. They contract the muscles, they close your arterial walls down, and then suddenly, just like a garden hose, okay, just like a garden hose, the water goes through the garden hose faster when we narrow the hose. So one of the effects of caffeine, besides the heart racing, is that your blood travels faster through the hose. So your brain gets used to that pressure. And so if you're somebody who gets a caffeine headache, when you don't have caffeine, it's because your brain becomes so used to the rush of blood that when you don't have the caffeine, your brain sends out a pain signal because it just doesn't understand why it's not getting its supply of blood that it was looking for. The other thing about caffeine that I learned when I worked for the chiropractor is if somebody has a tendonitis, like lateral or medial epicondylitis, and they're coming to you for massage, one of the things you can do with them is to suggest that they go without caffeine, because caffeine also contracts muscles, which pull on the tendon. which makes it harder for tendonitis to get better. The heart and other body systems, this is mostly about the heart and the kidneys, because the heart and the kidneys talk to each other all day long. The heart might tell the kidneys, listen, I've got too much volume. You need to let out some fluid, and then the kidneys start making urine, and that lowers the blood volume in your body. Or the kidneys may say, hey, listen, the blood pressure feels a little high. Is it because you're without enough blood? So they'll stop making urine for a while so that any fluids you drink turn out to be the fluid in your blood. So that being said, somebody like my niece, who I just went up to see this week, she has lupus, and the lupus attacked her kidneys first. And once her kidneys were down, then you go into heart disease, and vice versa. Somebody with heart disease, if it gets too advanced, usually ends up with kidney disease, because the organs so depend on one another that they sometimes cause the other to be diseased because of their dependence on each other. Blood circulation and headaches. If you think about all the muscles of your neck, the back, the side, even the front, arteries are deeper than veins. You can tell that just by looking at your distal arm, and you see all the blue veins. Well, your arteries are much deeper. So your arteries are not as affected by muscle contraction. I'm sorry, your arteries are not as affected by muscle contraction as your veins are. So if you think about somebody with a tension headache, okay, they're sitting at their desk all day long and their muscles are getting tighter and tighter and tighter. Well, the blood continues to pump up to your head through the carotid arteries, okay? But the jugular vein and all the other veins that help to bring the blood back out of your heart, they can actually get so tight that they impede the circulation of blood coming back down to your body, so you get a tension headache. So tension headaches are usually easily relieved by massage therapy. And if you even think about it yourself, when's the last time your shoulders got tense and maybe your head started to hurt, and your natural inclination is to lift your hand up to your shoulder and your neck and rub it yourself. Okay, so that's usually blood circulation and headaches. I'm going to leave the last three for Mindy. And what I think I'm going to do is, while Mindy and I set up, I think we're going to put on, I think the crash course videos are usually, what, 10 minutes? Okay, I'm going to put on a crash course video for you while Mindy and I get set up with the camera. And the heart part 1, the heart part 2. Do the circulatory one? Let's see how long that is. $11 minutes. Okay. Okay, if you guys still hear me, yes, you can. So we're gonna play an 11-minute video while Mindy and I get set up. And if we have to stop the video, we will, if we're all ready, so that we really can have some fun with the heart. Okay, so here comes the video.
All members of the Kingdom Animalia need oxygen to make energy. Oxygen is compulsory. Without oxygen, we die. But as you know, the byproduct of the process that keeps us all alive, cellular respiration, is carbon dioxide, or CO2, and it doesn't do our bodies a bit of good. So not only do we need to take in the oxygen, we also got to get rid of the CO2. And that's why we have the respiratory and circulatory systems to bring in oxygen from the air with our lungs, circulate it to all of our cells with our heart and arteries, and collect the CO2 that we don't need with our veins and dispose of it with the lungs when we exhale. Now, when you think of the respiratory system, the first thing that you probably think of is the lungs. But some animals can take in oxygen without lungs by a process called simple diffusion, which allows gases to move into and pass through wet membranes. For instance, arthropods have little pores all over their bodies that just sort of let oxygen wander into their body where it's absorbed by special respiratory structures. Amphibians can take in oxygen through their skin, although they also have their lungs or gills to help them respire, because getting all your oxygen by way of diffusion takes freaking forever. So why do we have to have these stupid lung things instead of just using simple diffusion? Well, a couple of reasons. For starter, the bigger the animal, the more oxygen it needs, and a lot of mammals are pretty big. So we have to actively force air into our lungs in order to get enough oxygen to run our bodies. Also, mammals and birds are warm-blooded, which means that they have to regulate their body temperatures, and that takes many, many calories, and burning those calories requires lots of oxygen. Finally, in order for oxygen to pass through a membrane, the membrane has to be wet. So for a newt to take oxygen in through its skin, the skin has to be moist all the time, which, for a newt isn't a big deal, but, I don't particularly want to be constantly moist. Do you? Fish need oxygen too, of course, but they absorb oxygen that's already dissolved in the water through their gills. If you've ever seen a fish gill, you'll remember that they're just sort of a bunch of filaments of tissue layered together. This gill tissue extracts dissolved oxygen and excretes the carbon dioxide. Still, there are some fish that have lungs, like lungfish, which we call lungfish because they have lungs, and that's actually where lungs first appeared in the animal kingdom. All animals from reptiles on up respire with lungs deep in their bodies, basically right behind the heart. So while us more complex animals can't use diffusion to get oxygen directly, our lungs can. Lungs are chock full of oxygen-dissolving membranes that are kept moist with mucus. Moist with mucus. Another great band name. The key to these bad boys is that lungs have a ton of surface area, so they can absorb a lot of oxygen at once. You wouldn't know from looking at them, but human lungs contain about 75 square meters of oxygen-dissolving membrane. That's bigger than the roof of my house. And the simple diffusion that your lungs use is pretty frickin' simple. You and I breathe oxygen in through our nose and mouth. It passes down a pipe called your larynx, which then splits off from your esophagus and turns into your trachea, which then branches to form two bronchi, one of which goes into each lung. These bronchi branch off again, forming narrower and narrower tubes called bronchioles. These bronchioles eventually end in tiny sacs called alveoli. Each alveolus is about 1/5 of a millimeter in diameter, but each of us has about 300 million of them, and this, friends, is where the magic happens. Alveoli are little bags of thin, moist membranes, and they're totally covered in tiny, narrow, blood-carrying capillaries. Oxygen dissolves through the membrane and is absorbed by the blood in these capillaries, which then goes off through the circulatory system to make cells all over your body happy and healthy. But while the alveoli are handing over the oxygen, the capillaries are switching it out for carbon dioxide that the circulatory system just picked up from all over the body. So the alveoli and capillaries basically just swap one gas for another. From there, the alveoli takes that CO2 and squeezes it out through the bronchioles, the bronchi, the trachea, finally out of your nose and or mouth. So inhale for me once. Congratulations, oxygen is now in your bloodstream. Now exhale. Wonderful, the CO2 has now left the building and you don't even have to think about it, so you could think about something more important, like how many Cheetos you could realistically fit into your mouth at the same time. So now you're all, yeah, that's great, Hank, but how do lungs actually work? How do they do the thing where they get moved to come in and out and stuff? Well, eloquent question, well asked. Lungs work like a pump, but they don't actually have any muscles in them that cause them to contract and expand. For that, we have this big flat layer of muscles that sits right underneath the lungs called the thoracic diaphragm. At the end of an exhalation, your diaphragm is relaxed. So picture an arc pushing up on the bottom of your lungs and crowding them out so that they don't have very much volume. But when you breathe in, the diaphragm contracts and flattens out, allowing the lungs to open up. And as we know from physics, as the volume of a container grows larger, the pressure inside it goes down. And the fluids, including air, always flow down their pressure gradient from high pressure to low pressure. So as the pressure in our lungs goes down, air flows into them. When the diaphragm relaxes, the pressure inside the lungs becomes higher than the air outside, and the deoxygenated air rushes out. And that is breathing. Now, it just so happens that the circulatory system works on a pumping mechanism just like the respiratory system, except instead of moving air into and out of the lungs, it moves blood into and out of the lungs. The circulatory system moves oxygenated blood out of the lungs to the places in your body that needs it, and then brings the deoxygenated blood back to your lungs. And maybe you're thinking, well, what about the heart? Isn't the heart the whole point of the circulatory system? Well, settle down. I'm going to explain. We're used to talking about the heart as the head honcho of the circulatory system, and yeah, you would be in serious trouble if you didn't have a heart. But the heart's job is to basically power the circulatory system, move the blood all around your body, and get it back to the lungs so that it can pick up more oxygen and get rid of the CO2. As a result, the circulatory system of mammals essentially makes a figure eight. Oxygenated blood is pumped from the heart to the rest of the body, and then when it makes its way back to the heart again, it's then pumped on a shorter circuit to the lungs to pick up more oxygen and unload CO2 before it goes back to the heart and starts the whole cycle over again. So even though the heart does all the heavy lifting in the circulatory system, the lungs are the home base for the red blood cells, the postal workers that carry the oxygen and the CO2. Now, the way that your circulatory system moves the blood around is pretty nifty. Remember when I was talking about air moving from high pressure to low pressure? Well, so does blood. A four-chambered heart, which is just one big honkin' beast of muscle, is set up so that one chamber, the left ventricle, has very high pressure. In fact, the reason it seems like the heart is situated a little bit to the left of center is because the left ventricle is so freaking enormous and muscly. It has to be that way in order to keep the pressure high enough that the oxygenated blood will get out of there. From the left ventricle, the blood moves through the aorta, a giant tube, and then through the arteries and blood vessels that carry the blood away from the heart to the rest of the body. Arteries are muscular and thick-walled to maintain high pressure as the blood travels along. As arteries branch off to go to different places, they form smaller arterioles, and finally, the very little capillary beds, which through their huge surface area facilitate the delivery of oxygen to all of the cells in the body that need it. Now, the capillary beds are also where the blood picks up CO2. So from there, the blood keeps moving down the pressure gradient through a series of veins. These do the opposite of what the arteries did. Instead of splitting off from each other to become smaller and smaller, little ones flow together to make bigger and bigger veins to carry the deoxygenated blood back to the heart. The big difference between most veins and most arteries is that instead of being thick-walled and squeezy, veins have thinner walls and have valves that keep the blood from flowing backwards, which would be bad. This is necessary because the pressure in the circulatory system keeps dropping lower and lower until the blood flows into two major veins. The first is the inferior vena cava, which runs pretty much down the center of the body and handles blood coming from the lower part of your body. And the second is the superior vena cava, which sits on top of the heart and collects the blood from the upper body. Together, they run into the right atrium of the heart, which is the point of the lowest pressure in the circulatory system. So all this deoxygenated blood is now back in the heart, and it needs to sop up some more oxygen. So it flows into the right ventricle and then into the pulmonary artery. Now, arteries, remember, flow away from the heart, even though in this case it contains deoxygenated blood. And pulmonary means of the lungs. So you know that this is the path to the lungs. After the blood makes its way to the alveoli and picks up some fresh oxygen, it flows to the pulmonary vein. Remember, it's a vein because it's flowing to the heart, even though it contains oxygenated blood. And from there, it enters the heart again, where it flows into the left atrium, and then into the left ventricle, where it does the whole body circuit again and again and again and again. And that is the way that we work. Our hearts are really efficient and awesome, and they have to be because we're endotherms, or warm-blooded, meaning that we maintain a steady internal temperature. Having an endothermic metabolism is really great because you're less vulnerable to fluctuations in external temperature than ectotherms or cold-blooded animals. Also, the enzymes that do all the work in our bodies operate over a very narrow range of temperatures. In humans, that ranges between 36 and 37 degrees Celsius. But the trade-off is that endotherms need to eat constantly to maintain our high metabolisms and also create create heat. And for that, we need a lot of oxygen, hence the amazing, efficient 4-chambered heart and our gigantic frackin' lungs. Ectotherms, on the other hand, have slow metabolisms and don't need as much in the way of food. A snake is totally pumped if it gets a meal once a month. So since ectotherms aren't doing much in the way of metabolizing, they don't need much in the way of oxygen. So their circulatory systems can be, a little bit janky and inefficient. It's still cool. Remember back when we were tracking the development
Okay.
Woo! Hi, hey, we're back. He's getting the camera changed.
Hello.
Hey, everybody, we're trying to get you to be able to see. No, they didn't ask one question.
I know. It's just it's funny, guys.
I don't think I know what his name is right off the bat. But you can look him up. Okay, all right.
How's the lighting?
How's the lighting for you guys? And then if you have can you make yours large screen? Okay. You want to make yours large screen, and I'm going to start from the top.
What does it say? Not good?
Was it not?
Kind of clear, pretty good.
Pretty good lighting, better. The lighting is good. They're all saying good.
Okay.
Most everyone is saying the lighting is good. Okay, so I got our pluck. This is called a pluck. I laid it out from top to bottom. So this is the trachea with the voice box, and the esophagus is laying behind it. It's inside all this tissue. We're going to cut open the trachea in a little bit. We're coming down to the heart that's right here in the center, and we actually got lucky. We have two pieces of pericardium that were originally around the heart before this little piggy was butchered. Here we go. Move this hand like this. Can you see the pericardium going around the heart? I'm going to let it come off. And then we have our little 4-chamber heart. We have the atrium and an atrium. And then we have the 2 big ventricles. And then the right lung we have is very large because it has 3 lobes. We have the left lung with 2 lobes. And then we came down and we got very lucky. We have a little piece. We have the edge of the diaphragm right here. And you can see that if I pull on the diaphragm, it's actually attached to the pericardium of the heart. And then we got a big, beautiful liver here. And I'm going to show you a little secret underneath. We got the liver with the gallbladder in it. And you see the gallbladder is green. It's got green bile in it. No, it's not a human heart. It's a pig heart. You can't get a hold of human hearts. Okay, so we're going to go back to the heart, and we're going to look at some of the things that we talked about today. Remember, I said the diaphragm muscle is what separates the thoracic cavity from the abdominal cavity where your internal organs are. And it's got a very thick piece of fascia here that does that. So here's the connective tissue that surrounds the diaphragm, and then here's where the muscle actually starts. And you can see that it's pretty wide. It's going from all the way from one side of the pig to the other, just like on us, okay? So here we have our 4-chamber heart. So if I hold it like this, we have the right atrium and the right ventricle, the left atrium and the left ventricle. I am going to, and then all the vessels in the heart come in or out of the top of the heart. So this is most likely the aorta. And then this is most likely the pulmonary artery that goes to the lung. And so what I'm going to do is I am going to open the right atrium. If you remember, the right side was a thinner wall of muscle. Okay, we have a thinner wall of muscle in the atrium here. And then if we get lucky, we're going to find, I'm going to take out a blood clot so you don't have to look at it. And remember we were talking about the valve? And here's the heartstrings of the valve. I can pluck them.
It's a little dark.
It's a little dark. Should I put on my bedroom light? Maybe. How about if I go up here? Can you see the heartstrings here? Let me open it a little bit more.
Can you come over to the side and maybe right behind you? Shine it.
Is that better?
Yes.
Can you see the heartstrings here from the valve?
Yes.
Now, if I put my finger inside the right atrium, or the right ventricle, I can come up here to the right atrium, the little tiny chamber on top of the heart. Now, if I come to the other side of the heart, we're going to open the left ventricle, and now look at the thickness of the muscle. And look, you can see strings of the valve really nicely there. And again, if I come out into the left atrium here. So we can see how thick that muscle is, and I cut it right at the valve so we can see all those strings. Now, the other exit that I'm going to look for that I just found is the aorta. So right now, my finger is in this vessel right here, which is the aorta. So I'm touching it here, and my fingers are touching each other right here. Now, if I go back to the right ventricle and I look for the pulmonary or the vena cava, I found the vena, I haven't found the vena cava yet. I must not be in the ventricle all the way. Oh, here's the vena cava right behind the atrium. Now we can actually cut the heart off. And when we do that, we can see all the vessels that enter into the top of the heart. So here you go. So this, when we looked at that picture earlier with all the heart valves, these are all the vessels that come in. So the pulmonary artery, pulmonary vein, aorta, and vena cava, the way they enter and exit is all through the top of the heart. So here's, okay, I'm going to orient it to you the right way. Here's the right side of the heart. Here's the left side of the heart. And then here's all the vessels. This is an atrium and this is an atrium that are both on top of the heart. So here we go. Here's another vessel. So all those large arteries and veins actually come in and out the top of the heart. And the heart sits like this in your chest. And we can see the outline, all the crevices here. The crevices are marking where those coronary arteries would sit that would actually take the oxygen to the heart muscle itself, remembering that we don't get oxygen from the blood that passes through the heart because oxygen for blood goes through the right side of the heart. So the heart muscle is actually getting it from the coronary arteries. So I'm going to stick my finger in here and see where I end up. I end up in the left ventricle. So my finger right now is in the aorta. Because if I go down, I find myself in the left ventricle. So I'm in the aorta right here. You can see how large that vessel opening is. That's the largest artery. Plus, when we compare the walls of an artery to the walls of a vein, you can definitely see the difference there too. Okay, so this is an artery, the aorta, and this is most likely the pulmonary vein. And you can see the difference in the walls. You can totally collapse this one where you can't this one. Okay, do you think I should stay over here? I'm going to try to get the lung. I want to look at the, so now we're going to look at, I'm going to show you guys 345. Okay, so here we have a very soft esophagus. This is the food pipe. So the food pipe is behind your breathing pipe. So the breathing pipe is right here. It's the trachea. I'm going to open that up. Okay, so if we look in there, we see this really hard plastic pipe. This is where your air travels through, and right behind it is where your food travels through. And we know that the trachea is in front because when they do a tracheotomy to help people breathe, if they can't breathe on their own, they cut right above the sternum, and that's where we find this trachea with this hard cartilage type material. And then behind it, we have this little springy esophagus where the food goes down. The lungs, so we've cut the heart off. We still have those wonderful blood vessels that were coming down to it. So here's the right lung. Here's the left lung. The left lung is only 2 lobes because the heart takes up some of that space in the chest. And so the right lung has 3 lobes. So it's 1/3 the size bigger. And that's everything is the same that we're looking at now in the pig or a goat that we would find in a human. It's exactly the same. So we have our 2 lungs, one on the left, one on the right. And what I would like to do is show you how the lungs expand. So I was looking for one of the, either the pulmonary artery or the pulmonary vein so that I could get air into the lung to show you what they look like when they expand and how they're not hollow inside. They're actually very spongy and thick around all the little alveoli. So right now, what I'm going to do is look for one of those vessels that will get me in to the lung. And I'm kind of feeling here. Is that the esophagus? Yes. Okay. So that's what I'm doing now. I might just cut the lung off and hopefully find my vessels. Yep, there's a bronchial tube right there. That's what I'm looking for. There we go. So you can see the bronchial tube, very plasticky, made mostly of cartilage. What? Okay. I'm going to do it.
Okay, you're gonna do it.
I'm going to do it.
You're blocking the light.
I'm blocking the light?
Yeah.
What should I do?
Stand right there.
Stand here?
Yeah.
Okay, you guys ready?
Got the strap? Here she goes.
I hope this is gonna work. Here I go. You want to push it for them?
You want me to squish it? Oh, there you go.
Oh. Okay, I'm gonna do it again. Can I see it really good?
Yeah.
Okay, I'm gonna do it again. Here we go.
Look at that.
Oh. Wow.
That's good practice.
Are they making any?
Yeah.
That's a lung. Yes. This is a lung. No, it's not like a balloon. That's what I'm going to show you in a minute. If it was me, I would have cycled and inhaled by accident. Oh, you guys are funny. No, I am getting a lot of blood though. So hold on here. I'm going to get a little deeper. Okay, here I go again. Remember, the lung is not hollow. All right, let me show you that. Now that we've blown it up, okay, I'm going to cut it open and show you that it is solid. But if you see these little plastic, these are your bronchial tubes that are going. Here's a little tiny bronchial tube. Here's a larger bronchial tube. And the lung is actually solid. It's just like a very soft sponge. Okay, and it gets redder when it gets smaller because the concentration of blood is more. When we blew it up, we dispersed the blood and it became more pink. But there's a lot of blood in here, which is why it did that. So here's where the main vessel went in here to feed the lung, probably the pulmonary artery here. All right, lastly, we can see the edge of the diaphragm here, which this looks more like a piece of steak because the diaphragm is a skeletal muscle. So it's going to look just like the meat that you buy at the butcher shop, okay, where the other muscle that contains in here doesn't look the same. The last we have to look at here is the liver. And deep inside the liver, we have this green gallbladder here that attaches itself to the liver. So I want you to remember this for digestion day when Mindy teaches you digestion. This gallbladder that the liver makes the bile, sends it to the gallbladder. The gallbladder sucks water out and then it sends the bile to your digestive system. Now we're not going to pop this open because I made that mistake one time in class and it's really, 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 really super smelly and stinky. So we really don't want to open that that gallbladder. So yeah, questions? Looks like other meats. How old was the pig? This pig was a very young pig. I don't know how old, but it was a younger pig.
Yeah, he said they were small.
They were small pigs, or they could have just been a small breed because this man used to be my mailman and he raises his own food. And so it might have been a small pig, but it might have been a mature pig because he raises them to adulthood. But yeah, see, here's the diaphragm muscle. You can see that it does look just like, ground beef or a steak because it is skeletal muscle. So it has the same look to it. The look and feel to it is a raw piece of steak or a roast. And remember, when you take nice deep breaths, the connection between the diaphragm and the heart is the connective tissue that connects to the pericardium. So earlier when I showed you the pericardium, which is right here, you can see that when you take a deep breath and the diaphragm contracts downwards, it's going to pull on the pericardium, which signals the heart that you're taking a slow, deep breath, which is part of what helps your heartbeat slow down. Dogs would be made the same way. This is all from mammals. Okay, so this is all coming from a mammal. If we were looking at anything other than a mammal, it would look very different. Well, not very different, but somewhat different. So, okay, you guys want to see anything else? Perfect. Okay, if you guys don't have any other questions, we're gonna sign. Oh, blow the lungs up one more time. I can't because I cut it open. But let me try the other one. Well, I guess I have to have a new straw. Okay, hold on. Is this the lung I cut? It is. Yeah. Yeah, good. Let me just try, just in case I didn't get the whole load. Okay, I'm gonna try, hold on. It might only do a little piece of it. Yeah. So when I'm blowing right now, all the air is coming onto my hand. Because I cut the lung, but let me try the other one. Okay, hold on.
So that's the left. So you can see it's a little bit smaller. It had a tiny cut in it from when it got butchered, but it's still blowing up pretty nice.
All right, everybody good? Mindy and I are gonna sign off. We've got a little cleaning to do. But Mindy will see you guys on Wednesday.
I can't read from here. Oh, I'm too blind. I'm too.
Thank you so much for today. You're welcome. Bye, guys. You have a great week too. Go ahead and sign out. Thank you, ladies, for a good class.
Oh, you're welcome, you guys.
You're welcome.
Sign on out. I'm going to turn this webcam off so I can clean up.
Yeah, voice box. Nice. Please.